Hello everyone, it's May 4th. I'm Dr. Adam London, Director of the Kent County Health Department, here for the daily COVID-19 update. Across the state of Michigan, there are now 43,754 reported cases of COVID-19, which is an increase of 547 over the previous day. And the number of deaths statewide, sadly, is over 4,000 now, 4,049, an increase of 29 over the previous day. Now these weekend numbers are always a little irregular. I'm not sure exactly why that is, but it seems like on Sunday and coming out of a weekend, our numbers seem to be a little bit lower. So we'll see what happens today and tomorrow. Here in Kent County, as of last check, we're at 1,834 cases, which is an increase of 48 over yesterday afternoon when we last reported our numbers. And sadly, we did have a few more deaths over the weekend, bringing that total to 39 deaths here in Kent County. So today I want to answer a few questions that we received on Facebook. The first of those is how many tests are being done in Kent County every day? The answer to that is between 800 and 1,000, sometimes a little bit more than that. We have a total capacity here in Kent County to do between 2,000 and 3,000 tests in a day if we had to, but on most days we're doing about 1,000 tests across the county. Next question, how many people are hospitalized here in Kent County? That number, thankfully, has stayed pretty flat for the past few weeks. Right now, we're averaging about 80 people in our local Grand Rapids hospitals that are hospitalized inpatient because of a COVID-19 infection. So that's one of the numbers. While we get frustrated a little bit with the case numbers because it fluctuates with testing changes, the inpatient hospitalization numbers are what we look at as a more reliable measure of our severe cases. And that's been pretty steady at about 80. Will you count Eastern equine encephalitis deaths as COVID-19 deaths? You may remember from last fall the EEE, Eastern equine encephalitis situation that we had in Michigan. That's caused by a completely different virus. It's not a coronavirus. And so no, if we were to have a EEE death here in Kent County or anywhere else, it would not be counted as a COVID-19 death. And also, so you know, mosquitoes cannot spread this coronavirus. That's not consistent with the way that this virus causes infection. And so while there's lots to worry about with mosquito bites, COVID-19 is not something you should be concerned about with mosquitoes. Next question, when do you expect to begin youth sports again? This is a really challenging question for us. And it's challenging because we have to watch the data very carefully and see what happens. While we've done a good job, you've done a good job in flattening the curve over the past month and a half, the reality is we've flattened the curve using some very extraordinary tools that we can't continue with indefinitely. And those tools are not conducive to doing things like entertainment and youth sports. So as those restrictions are loosened, and that's happening here in Michigan and around the country all the time, we're going to be watching very carefully to see how the epidemic responds to those loosened restrictions and the changing seasons. And we're going to make changes accordingly. Hopefully, we'll get back to playing things like youth sports in our normal way of life once again. But I don't want to get anyone's hopes up too high. The reality here is that we are dealing with a novel virus that we haven't seen before that's going to be with us, causing impact, causing illness, and causing death in some of our most vulnerable in our population for a while to come yet. And so we all need to do our part to do what's reasonable in reducing the prevalence of that virus, that epidemic. Another question, how long can a person be contagious before their symptoms develop? About 1 to 2 days is what the best science is telling us now. And that's why when we do case investigation, we're looking at all of the exposures a person had, all the people that case was in close contact with up to 48 hours before their symptoms developed. But we also realize that some people will never develop symptoms, and they also will be transmissible with the virus during that time period as well. So that's why it's so important that we do things like wearing the masks in public, because the masks aren't there to protect. If I'm wearing this mask, it's not there to protect me. I'm wearing it because I may be protecting you. If I have the virus, I may be spreading it unknowingly to those around me. For that reason, I wear a mask, and we recommend that everyone wear a mask while they're in public spaces, in public buildings. And the reason, again, for that is to protect others. Now, I'll be totally honest. The masks are not a perfect tool. They're not. There's all kinds of ways that you can make matters worse by wearing a mask. And not everyone can wear a mask, so let's not pass judgment on those who might not be wearing a mask. The masks, they have some benefit, and we've seen in other outbreaks in other places around the world where wearing masks has some benefit, but don't think that this is a fail-safe. It's one tool of risk reduction. It's one way that we can limit our risk to others and to the community. So wear the masks. Don't pass judgment on those who aren't, but just remember, it's not bulletproof. It's just one tool that we should take advantage of in order to reduce that overall risk to our community. That's all for today. I'll be back tomorrow to answer more questions. Stay positive, stay heroic, stay healthy. I'm Dr. Adam London from the Kent County Health Department.